Hello and welcome to our next episode of How Are You Really podcast. Our episode today is ADHD Parenting Hacks, Navigating the Journey. I am your host, Dr. Faryal Mallick. I'm a child, adolescent, and adult forensic psychiatrist, and I'm very pleased to welcome Dr. Lesley Cooks today. Lesley Cook, not Cooks. Dr. Lesley Cook is a PsyD. She is a licensed clinical psychologist with over 15 years of post-license experience. She initially trained in the area of neuropsychology and has developed a specialty in the diagnosis and treatment of neurodevelopmental disorders, including ADHD, autism, learning disorders, and anxiety-related disorders. Dr. Cook believes in the power of safe relationships and emphasizes a strengths-based neurodiversity approach in her work. She has developed a parenting education program that she uses with her clients and hopes to bring to the public next year. She is also the parent of 3 children with neurodevelopmental disorders and is diagnosed with ADHD herself. Welcome, Dr. Cook.
Thank you so much for having me.
Of course, of course. So I'm going to first ask you, how did you end up focusing on ADHD?
That is a wonderful story. So I originally trained my diagnostic practicum year. It was with a neuropsych site, a wonderful site in Hawaii where I was very overwhelmed for a year, learning a lot of things. And during that rotation, it was really focusing on these diagnoses. My supervisor at the time pulled me aside and said, one of the things we need to do is to talk about your own story. Like, how have you managed your ADHD and gotten to this point in your life? And I said, I don't have that. I don't have a diagnosis of ADHD. And she said, oh, no. Yes, you do. Absolutely. And so that started me on a whole self-exploration journey. I mean, at that point I was in my mid to kind of late 20s. I got diagnosed at my clinic while I was learning about the diagnosis. So it was an incredible time that was scary, but also so exciting. And I think that it really just captured me from that moment on. I've circled around in different areas in my career, but always somehow landed back in this area. This is just kind of, I think, my home in the field.
That's amazing. That's, very heartwarming. So, okay. What are the common misperceptions you notice with the diagnosis of ADHD that you come into in your practice?
I think one of the most common, and I understand this, very much, is that people are often told that ADHD can be caused by some things that it's not caused by. So excessive screen time, or just a traumatic experience, or the food that a child is eating. And certainly all 3 of those things affect ADHD. They can affect how pronounced it is and how the course of the diagnosis goes. But we don't have evidence at this point to say that ADHD itself is caused from bad parenting or something in the environment. It really appears to be mostly genetically loaded. It hangs out in family groups. That is a really common one. Another common misconception that I see is once a child is diagnosed, people tend to say, well, great, now we know, so we can figure out how they're going to overcome it, right? We're going to get rid of it. That there's a misconception that you can kind of be healed from it. But ADHD is a neurotype, we think, or a neurodevelopmental diagnosis. It comes with our neurology. So really what we're doing is helping kids become adults who can adapt to how their brain works and then build skills as well. And I think the last one that I see is that there is a belief that if we don't overcome the symptoms, that children will not achieve anything in adulthood. And I'll be the first to share my story with people myself and say that you can have pretty pronounced symptoms and be a very successful adult human. Yeah. I think that's important.
How do you deal with parents when they come in? What can I change in my diet, like in my kid's diet, for them to overcome ADHD?
Yes. And I think that with most of these misconceptions or questions, there's like a piece of an underlying really lovely sentiment in there. So I try to really focus on the idea that what I hear the parent saying is, what can I do to ensure that my child is as healthy and well as they can be? So I kind of pivot with them to say, well, everyone has a central nervous system and a digestive system and a sleep regulation system. And so for all kids, having enough healthy food for fuel is great. And it's going to help us achieve at our highest capacity. So ADHD kids are the same, but we really want to focus on wellness, not necessarily on perfection or eliminating a specific toxin, because there just isn't strong enough evidence to show that that has any, measurable effect. There are a subset of children who can be sensitive to foods, and that can affect their behavior. But if that is the case, usually I advise parents to really work with an allergist or an immunologist to figure that out. So I guess the short answer is we shift to wellness instead of getting really focused on one thing.
Yeah, and I think that it's really important what you just said initially about realizing the sentiment of the parents, right? Like that they just want the best for their child. And I think that gets lost because in this day and age, like people just Google and there's a lot of misinformation and they get it. And then for us being mental health care providers, we get frustrated because there's that misinformation. But remembering the parents are only coming in with that hope that like they can do the best for their kids is important.
Yeah. Yeah, so important.
So, what strategies do you recommend? How can parents effectively support a child with ADHD?
It's my favorite topic. The first thing that I advise parents to do is to get really curious, to almost imagine that you are like Jane Goodall in the forest and you're observing a little group of gorillas. Because I think with ADHD kids specifically, we rush to solve and we rush to fix. And sometimes we don't take the time to observe, like, when are they focusing really well? What kinds of activities make them filled with joy and creativity? What are areas of their life where they feel competent, where they are organized? Almost every child has certain areas of their life where they do show the capacity for all of these things that can be impaired with ADHD. So when we slow down to notice that, we might find hidden secrets that we didn't realize. Like, wow, my child focuses way better when he's been outside first. Well, there's some evidence for why that happens, that vigorous physical activity, play, can wake up the part of our brain that helps us apply the brake. So we wake up that brain before we need to focus. But if we don't take the time to look for those strengths first, sometimes we jump very quickly to a solve it kind of pattern. The other thing that I advise parents is try functional interventions, not necessarily the cutest or the most complicated or what your neighbor tells you to do. ADHD kids need creative solutions. Sometimes they don't make any sense. And it can be hard as a parent who has done this myself to invest a lot of time and money on an elaborate reward system when really ADHD kids need things to be functional, short, easy to understand, and then easy to carry out so that they have lots of opportunities for reinforcement.
Yeah. All right. So we already kind of talked about diet and exercise a little bit. So that's really great. I think that why do you think that exercise plays such an important role in ADHD?
There's all kinds of research. I was looking at this last week for something else, and it's very interesting because there doesn't seem to be a perfect conclusion for why that is. But one of the reasons we think is because, again, it wakes up, it increases blood flow and activation for the parts of the brain that allow us to slow ourselves down or focus when we want to. But there is another aspect that could be related to like sensory regulation. So ADHD kids, a phrase you'll hear a lot is feeling like they're driven by a motor. They have this drive, and sometimes it's very physical. Sometimes it can be totally in their brain. Like they may not be seen moving, but their thoughts are moving. And so exercise is something that brings our nervous system into the present moment. We have to be kind of all right here. So the more we do that, it's a bit like training that nervous system to be able to harness that integration of our senses. A lot of ADHD kids, I'll include myself as an adult in this camp, we're drawn to more passive activities. So video games sometimes, watching videos, because it can be relaxing. We're working really hard, but too much time on those things don't necessarily give us the chance to practice that organization. So that's why exercise can be helpful.
Yeah, that's really good way of explaining it. And I think that that's important. So what about routine and structure for children in ADHD?
Yes, I think this is one of the most important topics that when I work with families, we spend a lot of time on this. There's kind of two things that are important. I think number one, children are developing creatures. They are still cooking. So for all children, routine and structure helps them explore the activities they can do and the skills they're learning with safety. So they're able to practice.
Yeah.
So for ADHD children, the other thing that's happening is that actions that are automatic for other kids are voluntary for ADHD kids. And what that means is some children can see their water bottle across the room and say, "Oh, I'm thirsty." And then they just get up and get their water bottle. That feels like one action, but actually there's several things that happen in that moment. You're noticing, you have the motivation to get up, you can make your body go. For ADHD children, even actions as simple as that sometimes cost them energy and effort. So the more we can outsource that energy, the easier life gets for these kids. So for instance, if you're working with your ADHD child on remembering to do their homework, it's going to be way more effective if homework time is at or around the same time every day. It's even better if it's at the same time every day and there's an alarm that goes off. The more we can outsource that so that they don't have to hold that in their mind, the better they're able to practice those skills and eventually, hopefully, internalize them or use other reminders in their adulthood to help themselves. It's a bit like when we use autopay for paying our bills. It's not that we can't pay them, but it reduces the stress level on us when we know that there's a supportive strategy.
Yeah. Yeah. With that, I'm just gonna add in as an adult with ADHD also. I have like so many different types of planners on my desk because one of them is like, okay, today I'm going to do this, 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 and this is important and this is the to-do list. But then there's another one which says overall super important and less important and this can wait. So there's different planners, right? How do we teach kids to do that starting at a young age for ADHD kids? Because, you know, I think I learned this mostly as an adult. I was diagnosed as an adult. So, you know, it was much more of a, I think that med school, even after med school, so med school would have been a lot easier for me if I was diagnosed before. But yeah, so how can we teach those skills to kids?
Yeah, this really goes back to the idea of a toolbox approach. So when we're teaching kids things like study habits, there is a tendency to think of like, here are 10 good study habits. And so if you're a person who tries those and it doesn't work, then you're in the bad camp. With ADHD kids, we don't want to think about good and bad. We want to think about functional, what works. And we want kids to have multiple tools for the same thing. The best example that I have is cleaning a room. This is one of the big ones that they get referred for help. So I have 3 main methods that I teach families for cleaning a room. One of them is parents clean the room for the child first, which the kids love. Then they take a picture of that. They print it out and they put it on the wall. So every time it's time for a child to clean the room, they just make that look like that. That works for some kids. There is another method called the bulldoze method where you go in the room and you push everything into a corner. And that way your room is already looking way cleaner because you just smashed it in a corner. Now we're going to just put music on and put one thing away at a time. That's another tool. And then another one is to work for time. So to say, we're going to do 30 minutes of cleaning your room and then always double on the break, and then an hour away, go away. And then we'll come back and do the other half. We don't want to pick one and get anchored to it because ADHD is a fluctuating diagnosis. Some days we have access to all of our skills. We're just on fire. We're doing everything. And other days we're working 20 times harder than usual and getting less result. So we want to have tools for the hard days and tools for the easy days. So I think that's really parents adding tools to what kids can do rather than teaching them what's right and wrong.
Mm-hmm. Okay. So as you were talking about like taking the picture and kind of like doing it that way, I'm thinking about one of my patients, but this, you know, kid is like 13. So there's that teenage aspect added on top of it. So would that work for a teenage kid? Or like,
it depends
what do
on
you
the
think?
teenage child. It's much less likely to work with a 13-year-old. But I think this is where a toolbox approach is important because let's say that approach did work for your child and all of a sudden they're 13 and they think you're the worst parent ever because you're wanting them to clean their room up. We don't want to get so fixated on but it used to work. We want to say, okay, that used to work. It no longer works. So the other piece, especially with teenagers, is to have flexible expectations as a parent and focus on what's most important. Teenage rooms might smell bad and they might look horrendous, but if your child knows where their things are, has clean clothes to wear, has no active bug infestations, you might want to consider loosening some of the expectations for a period of time to focus on their functioning. Now, if they're not functioning, if they're not showering, if they don't have clean clothes, then what I advise parents to do is focus on one of those areas at a time and experiment with your child different ways to do it. So this week, I'm going to remind you every day, but next week, I'm going to not remind you. And then let's compare what worked better. So you're really allowing your child to now have more power in the relationship.
Yeah. Yeah. At some point, mom came to me and she was like, I'm just gonna let it gather and hope some maggots grow. Maybe that will
No
work.
consequences. Yeah.
And I was like, I hope it doesn't get to that point, but you know. Okay, so technology. What tools are available for kids with ADHD? I know that a lot of parents are also very concerned about giving phones or whatever. And of course, there is a risk, understandably so, but like, what do we have available and how can we make it available to the kids safely?
Yeah, that's such an important question. I think one of the things we do know is that unrestricted access to the full internet at any age is one of those challenge areas. We don't see our ADHD kids making the kinds of decisions that we would like them to make. Now, that's not true for every child. There are children who, for whatever reason, are very responsible with an unrestricted internet. But there's a lot of exploitation that can happen on the internet. One thing I do not advise is a completely hands-off attitude from parents. I do not advise that. What I do advise is to focus on starting, if you're starting with young children, focus on the things that are most restrictive first. So things that do not allow you to interact with others, things that can be monitored, and then build independence and add access as they show competence in dealing with that level. Don't worry too much about the age. Like if they're 11 and most 11-year-olds can control themselves on YouTube, but your child can't, you may need to choose a different video interface than YouTube. And that's okay because we want to make sure that they're safe. Also, though, introducing children proactively to technology and games and websites and things that are places where they really can be unmonitored, where it's relatively safe. This sounds kind of nerdy, but if you have an ADHD kid who also is really into like facts or science, there's apps like Curiosity Stream, which is a very affordable video app for like mini documentaries on every topic you could imagine. So that's a wonderful place to like go deep dive, learn all you want there. Also, a lot of parents are really afraid of AI, but there are some AI tools right now that are so helpful with our like preteens and teenagers, where let's say your child really struggles with organizing what their thoughts are to make an outline for a piece of writing, and they can agonize on that for hours. There are ways to use specific AI engines where the child has to still have their ideas, but you can ask the AI, I have to write this essay over 6 days and it has to be this many words. What's a good plan? And the AI will plan it out and give them suggestions. That's a wonderful way to try. What was the other things you want to notice though? If your child's mood is changing, if they are showing signs of being really concerned about body image, or they've stopped engaging in anything off of technology, those are some of those early warning signs that we may want to pay attention to what they're doing and what they're seeing. Because again, our ADHD kids have a hard time stopping themselves. And they can quickly end up in a situation where they're not sure what to do.
Since we're on technology, do you think that video games or like the video game addiction is more common with ADHD kids? Or do you think it's just equal, it just is more prominent because they're not organized and doing other things?
It's probably the latter. I don't think that we have strong evidence to say that ADHD kids can't have the internet because they can't control themselves and they're all going to be internet addicts. But when there's no parental management, they can be at higher risk. So it's really kind of an in-between answer where we do want to teach them the skills for regulating, but a lot of it has to do with our ability as parents also to set limits and give them opportunities to get off of tech. The other problem is, and I'm guilty of this as well, as parents, sometimes we really want our kids to validate how good of a parent we're being. but they don't think that a lot of the time, and that's okay. So if you are setting technology limits that are reasonable and your child is frustrated with you, that's not necessarily a sign that you've done something wrong. That's their job, is to be mad.
Yeah.
I also really
That's very
encourage
true.
parents to ask their kids what they think. How
Hmm.
much time do you think? Do you think this is working for you? Do you want more time or less time? Why? How would we know if it's too much? Really include your child in those discussions.
Yeah, yeah. That was going to be my next question, right? What all can the kids be included in to help manage their ADHD within the home setting with the parents?
I think we should always invite our children's opinions and listen to them and communicate that we value what they're saying. Just like with any other adult, listening and validating does not always mean agreement. We're going through this in my house right now with my 13-year-old, perfect timing, where he wants to have access to his technology at night because sometimes he has a hard time sleeping, and putting a video on helps him go to sleep. My parent brain was like, that sounds terrible. Let's not do that. You're going to wake up all night. But what we did is we did an experiment. So we said, okay, we're going to do that for 3 nights, and then we're going to reconvene. And if it doesn't go well, I reserve the right to do parent things and say, we're not going to do that. Actually, it worked out really well. He's very happy about that, that I lost that one. But I think it's so important because we want our children to be able to come to us with ideas and strategies. It's their brain. So if they can't tell us what they think, we lose access to a whole bunch of interventions we could be using.
Okay. Going back to just technology and AI. So not only the parents have a fear of letting their kids use AI, but they have like this fear of AI in general. How are you in your practice, like helping people come over, like the parents just overcome their own fear before they can let, that other fear of like their child using it be overcome?
Yeah, I think the biggest antidote to fear for anything is exposure to it. So I encourage, again, I think it's like what we do for the kids. We validate that that's a real concern. This is still developing and unknown, and it can be really scary to think about how is this going to impact myself. I know that college students are still trying to figure out how much AI can they use without it being flagged? Because sometimes they're not doing any kind of nefarious activity, but it'll still flag if you used it for your outline. So I encourage parents to explore the technology with me. If it's a video game, I encourage them to play it with their child. Get to know what your concerns are before we make judgments on the outside. And then it always goes back to what's functional. So if we were talking about games, Minecraft is a wonderful, creative game for children. ADHD kids love Minecraft. I love Minecraft. If your child is able to transition on and off Minecraft and do their homework and go play, there's no reason to say that there's a perfect amount of time a day. If your child is having meltdowns transitioning off Minecraft and is refusing to do anything else, we're going to pay attention to the functional effects, and then we'll make decisions about whether that's appropriate. And I think the same is true for AI tools. We try to worry less about what our beliefs are about it and more what the actual functional reality is. And then parents make their own decisions, I think. Some parents really are still very uncomfortable with it, and that's okay too. There's other tools.
Yeah. Besides AI and technology, what about parents managing their own stress? So when parents are stressed out and their kids have ADHD, how is their stress impacting ADHD? That's an important question for everyone to know, right? And then also, how should they manage it?
Yeah. We cannot forget that we are also humans in the room. And just like our kids need fuel and sleep and rest, we need that as well. It can be really challenging, especially for parents who are so invested in their child's well-being, to remember that being a calm, regulated parent who isn't always doing all of the interventions and things is okay. Sometimes if we know that we are reaching the point where we're becoming snappy or reactive, it is okay to take a break. It is okay to say, I need to walk away for a minute. We see this a lot with arguing. So ADHD kids typically are very good arguers. They can see every possible way to disagree with our decisions. And I work with a lot of parents to stop at some point when they're being dysregulated, to stop engaging with the question, to communicate respect for their child, but also self-respect. I need to take a break. We want to model that for our kids too, because we want them to do that when they're feeling dysregulated, to be able to recognize it and step away. The other piece is making sure that you have some kind of community connection to at least one other person who gets it, who you can tell this is the day we've had, and they're not going to question you or ask you why you haven't eliminated sugar or gluten or whatever else. Not that that's bad. I'm sure that's great to do that. But we need to have access to community supports with people that understand what we need.
Now, part of the family unit, siblings, what can they do, right? There's sometimes siblings that they all have ADHD, but a lot of the times one sibling doesn't and doesn't understand what's going on. So how can we involve the sibling in that case, and what can the siblings do to help support?
I think that is so dependent on the age. So sometimes when the non-ADHD sibling is much younger, that's actually harder because there's not a lot of explaining we can do. It's important, I think, in families where we have hyperactive, impulsive ADHD kids to make sure that we're taking things like hitting or scratching or biting very seriously in terms of being clear with the non-ADHD child that it's not okay, that there might be an explanation for why that's hard for your brother or sister, but it's not okay that they hit you. And I will always make sure that they know that that is not okay and protect you. Sometimes there's a chance of over pathologizing the ADHD child. So like making the child kind of the central problem of the family. We don't want to do that. We also don't want to always run to save the ADHD child and then kind of ignore the child who's not like a problem in the family. Those dynamics are common. If you find yourself there as a parent, you're not alone. But once you notice it, we like to shift back towards this like neurodiversity affirming model, which is everyone in the family has strengths and challenges and needs. And every single person has that. This person's strengths, challenges, and needs are called ADHD. Yours are not. They're just kind of how you're built. So it's like equalizing this idea that everyone needs different things so that there doesn't become like one patient in the family and everyone else is like quote unquote normal. We don't want that to happen.
Yeah, absolutely. Okay, so and this was also in my mind, what is like the point where parents can kind of recognize, okay, maybe a reassessment is needed. Maybe this diagnosis is not right, or maybe it's too severe, or maybe they are at that point where medication is needed. What are some signs that like parents can kind of recognize or pick up on to realize that there's a reassessment needed?
Yeah. I think the first one is when the strategies that you've been using are no longer effective. And we're not talking like we just need a newer strategy. It's like where things just stop working. We often will see that with children who are not managing with medication, they're managing with behavioral change. And around third and fourth grade, so let's imagine they're diagnosed quite young, third, fourth, fifth grade, all of a sudden we see grades are going down, more anxiety. Maybe we see more of that repetitive behavior that we see with some ADHD kids picking at their nails or their clothes. Those are signs that maybe their skill set is starting to max out and they might need to be looked at for medication. What I tell parents is that when we're doing a toolbox approach, medication is just one of those tools. They're equal in importance with everything else. The beauty of appropriately prescribed meds is that they seem to give kids more room. It doesn't fix anything. But if a child is struggling to apply these strategies for studying for a test and they just don't have the focus and energy, medication can give them the room and now they can practice. We see this also in my office with kids that have been treated with non-stimulants for several years, maybe for sleep, and it's going really well. But now they're getting reports home from school saying, hey, what's going on? He's not bringing his homework in. He's laying down sleeping in class. So these dramatic changes in functioning might be reasons to get reassessed. Another reason to get reassessed is if you see changes in mood or anxiety. We don't want to ignore those. So if we have a sudden change and our child is sad all the time, they're teary, they're very anxious, they don't want to go to school, if they're withdrawing completely, that might be a reason to go back in to make sure that there's not an additional diagnosis, that there's not something with anxiety or depression happening as well.
Yeah. So, how I want to talk about, like you had talked about hyperactive and kind of impulsive aspects of ADHD, right? A lot of the times they're labeled as oppositional defiance disorder, which I think it's just part of ADHD, right? Really have to put that disorder on there for it to be there. So for those kids, what have you seen in your practice Do you feel like the behavioral modifications kind of max out sooner, or is it the same rate? Like, and what is your strategy if they're being that aggressive towards siblings or in school? Do you say, okay, let's get them medicated and then work on the behavioral issues? Or what is kind of like your approach to those kids?
And obviously, all of our approaches in all parts of this field are individualized. So these are generalizations. It would depend on each child. But anytime there's harm happening, I absolutely will tell parents that the first line treatments for ADHD of that type are medications and therapy combined. We see the best and most powerful symptom reduction when they're both happening. Some children cannot take medications for a variety of reasons, and that's okay. But the other thing that I talk with parents about, and this is where kind of our model of doing this is a little bit different than what you might see in some other behavioral clinics. We don't necessarily come in really hot with like a packaged behavioral modification program. Instead, we work with parents on understanding how their child's behavior works through examining the barriers. So if we have a child who is hitting, we're not going to jump to hitting reduction. We're going to look and see when, why, how, for what reason, why is he able to do that? Why has she been able to? There's certain triggers, and we're going to really look for what is missing here. Is it a skill that's missing? If it is, let's practice that skill. Is this really so neurologically impulsive that it's not fair to practice a skill? And that's a medication. Or could there be an additional factor here? Could there be something else happening that's biomedical or trauma-based that this child actually needs a therapeutic intervention? This needs to be dealt with a specialized therapy. But yeah, usually we recommend at least have an evaluation for medication at the same time as beginning some kind of behavioral counseling.
Yeah, I really like your approach of like not just throwing the behavioral modification program. Can you talk to me a little bit more about like how you are doing this and what the strategies are that you are using, how you're evaluating?
Yeah, so we have a little model called the bridge model, and it's with a visual metaphor. We find with ADHD kids come a lot of ADHD parents, so we like things that are brief and understandable. So if you picture yourself on one side of a little bridge over a creek, and on the other side is how you would like things to be. So if my main issue is my child is incredibly impulsive and is running into the road and just having a lot of trouble in school, then the first thing we're going to do before anything else is describe how we wish it was, because we're going to catch whether parents are being overly optimistic. Like some parents will say, well, in my ideal, he's quiet and compliant all day. And then we say, okay, let's learn about development, because that's not going to happen. So we reformat what our goal is. I'd like him to be able to engage in school successfully without getting in trouble or hurting anybody. Great. Now we're going to say he would be there if he could be. And that's that reframe. This is not about training him to fix his problem. This is about asking ourselves, well, then why aren't we there? And there's 3 types of barriers we look for. One is what skills are missing. And so we ask parents, can he activate when he needs to? Like get up and go. And maybe they'll say, oh yeah, that's not a problem. Then I'll say, when it's time to slow down, can he slow down? And they'll be like, no, he can't do that. There's our skill. So then we're going to do some therapy sessions, practicing, activating, and slowing down. We might even have him bring his games in. We're going to go on the Switch and play Minecraft and then practice stopping Minecraft. The second area of barrier is things that are never going to go away. And we need supports for those. So does he have an accommodation in school for this? Maybe that's why this is happening, because he has unfiltered access to everybody. Maybe he needs specialized seating or access to like a chill pass that when he starts getting frustrated, he's allowed to ask and go to the counselor. That way he doesn't have to have a meltdown in class. And then the third barrier is we talked about before, where there are missing therapies. Like maybe this child went through a traumatic divorce and they need something else. So by looking for the barriers, then we plan our interventions around the barriers and we practice them in therapy. We don't just throw a program into school. That way we build the competence and the confidence of the child and parent. Then we move it out. So this takes about 6 to 8 sessions to get it rolling. It's a little bit, longer than parents want. Like, let's get in there and fix it right now.
Yeah, yeah.
I think that's the biggest barrier for parents, is realizing that this is a whole way of thinking that we're going to shift. And it can take a little bit.
Yeah. Yeah, no, but this is incredible. I really like this approach and just kind of, it's almost like a psychodynamic approach for ADHD. And I really like it. Like you're kind of like getting in there and finding out why the behaviors are happening. And, from every aspect, it's not just the child, it's the environment too, right? What's going on in the family unit and the parenting and all of that. So kind of tackling it all over, overall. All right. So what about communication? So children with ADHD, even adults with ADHD, right? It's hard for them to their perception is maybe a little bit different too. So just in general, the communication, how can parents more effectively communicate with their child with ADHD?
This is an area I work on every day with my own three. It's best if we are short and to the point and end with some kind of a question. So something like, I can see that it's been hard for you to stop playing. In 5 minutes, we absolutely have to get in the car to go. Would you like me to set a timer? That's about as much as they can do. And obviously, as kids age, they can do more. But the less talking and then ending with their contribution tends to be a rhythm that just works better with this group of kids. What you'll notice is if you do that more regularly, your kids will start doing it to you. They'll come back and be like, Mom, I want to go to the mall on Saturday. Does that work for you? And then you'll see that there's this rhythm happening to provide them a little bit of structure. ADHD kids can get very overwhelmed very quickly, which also increases their chances of being impulsive. And even though emotional up and down is not part of the criteria, it kind of is. It comes with this dysregulation. So keeping it short and sweet, which I struggle with.
No, but like the emotional dysregulation aspect of it, right? A lot of people don't understand that mood instability also is like almost hand in hand with ADHD. And that's such an important aspect. A lot of the times that depression might not be a real depression, but just kind of like that, just, dysregulation from having ADHD and severe symptoms of ADHD. So yeah, I think that that's important. How can parents communicate to their child about the illness, about having ADHD, right? What is it? How would you explain it to a child as a parent that you have ADHD?
I really, when we do this in the clinic, when we do a review of results for the parents, and then we usually bring the kids in separately or with the family. We really talk about telling the story of your brain. And we start with the basics that all brains are organized to keep us safe and to interact in the world. Some brains can do some things better. We usually will tell a story with kids about what's something you didn't used to be able to do, but now you can do really well. Well, that's because your brain changes as you grow. One thing we've learned about your brain is that your brain doesn't always show up with the kind of focus and attention and self-control that you need. That wording tends to help kids not feel criticized when it's a simple way of explaining, even when you're trying hard, sometimes your brain doesn't show up to the party and you're left to figure that out. And that's not really fair, and other people don't have to deal with that, but it is what it is. So what are we going to do? We're going to support you. We're going to help you gain tools to help your brain show up. You and your brain are going to work together, and we're going to do that in all these different ways. I do think it's also important as kids age, though, to let them know that this is a category of disability as well. It's not all sunshine and rainbows. I wouldn't change who I am, but there's certainly days where I really wish I could do a sink full of dishes without feeling like I needed to run out the front door. So we need to validate that this is a harder road a lot of the time, and they're not making that up.
Yeah, yeah. So yeah, that's a really good way of putting it. And it sounds like the way you said it is I wonder if parents would have a difficult time putting it that way. Is there an easier way for parents? Because, the way you say it, that's amazing. And I'm learning. I'm going to use those words because that's such a good way of putting it. But I don't know if lay parents can actually put it that way. Is there a simpler way we can even simplify it for the parents?
Yeah, I think really honing in on the idea that every brain is different. Your brain is really good at these things over here. And when these things happen, it has a harder time. So it's harder for you to focus, but it's easier for you to be creative. So because it's harder for you to do this, I need to help you learn some things, and you need to do some things to help your brain. And this is who you are. It's how you're built. There's nothing wrong with you because of that. but it's important that we know that. Sometimes also parents can give analogies. So I am very short. I am 5'1". I can really hope that I am going to wake up and be tall enough to not need a stool to get the cups down from the top shelf. And I can work really hard and stretch really hard, but it's kind of unfair to myself. I'd rather just use a stool. And ADHD is kind of like that. Like, it wouldn't be fair for me to say, just work harder to focus. I need to help you, teach you some strategies, and maybe have some medication to help you to be able to do that.
Yep. Yeah. Let me take another pause. This one is like, she does not like me
Poor
today.
baby is abandoned. I feel like it's so perfect for the topic, though. It's great. That's the kitty cat is how I feel when I'm trying to focus on something, and then I have the other thought come in. It's like, you should really think about this.
Yeah, it's like she's just like, yeah, nonstop. Now she's in here. Hopefully she'll stay quiet. Okay, a lot of the parents are super afraid of getting their kids diagnosed with ADHD. Like, I've had kids been brought in, like, 3, 4, 5 years old, and of course, it's a 4-year-old child. I just don't like seeing 4-year-olds because it's just like really sad because it's that bad. That's why they're coming to me, right? So, and they have this huge fear of the diagnosis. So when you have given them the diagnosis, how do you help parents deal with that? How can they be okay with that diagnosis for their child?
Yeah. Whenever we talk with parents of newly diagnosed kids, we spend a good few minutes talking about the fact that it's normal to be afraid. If a parent had absolutely no hesitation or fear about a medical diagnosis, that would be odd. So that, I think, helps when you hear that I work in this field and I was nervous about it. The second thing to remember is that ADHD is one of the most treatable diagnoses there are. We know so much about it. Also, the medications that we use to treat it have gotten better and better and better to the point where now we've got data that shows us that it actually is reducing lifetime risk for things like bad auto accidents or self-harm or addiction. Children that are prescribed appropriately and are treated from that kind of middle childhood age on do better, not worse, because we hear a lot of very scary things in the media. The other thing, though, is that when you have a child with a new diagnosis, you don't have to do everything right now. The most important thing that you need to do for your child is communicate that you love them, that they are safe, and that you are partnered with them to make sure that they're going to have what they need for their life to turn out well. You can add interventions very slowly. You can spend the summer doing a behavioral therapy. You don't have to take them out of school right away if they don't need it. You can there's ADHD summer camps where they can go hang out with all the kids that want to do kayaking all day for 12 hours and then crash. And there are wonderful communities of parents and people like me and you who are, I want parents to think of us here, that we're the future of their kids, that your kids can be okay. And there's no rush to fix anything. The fact that you've gone through the process of getting them diagnosed means that you care and that you've started them off on a path that they need. So good job.
Yeah. No, that is really good advice. And how about like looking at on the other spectrum when parents feel like the behavioral issues can be fixed with just medications thrown at it?
Yes.
How do you deal with that in your practice? And what advice do you have for those parents? Because those parents come to me and I'm like, no, I don't think we're ready for medications yet. But it's very hard to convince them because they want a quick fix, and that's a quick fix.
Yeah. And again, I think that's another variant of very normal parenting impulses. Like, something's wrong with my child. Let's get it done. Let's fix it, because I can imagine all the bad things that can happen. So validating that as well. The challenge is, and this is where I think we've not done the best job in my field of communicating what ADHD is. When you have a diagnosis like depression, the goal is reduce depression. We want those symptoms to go away. We want no depressive symptoms, right? And so in those cases, we give medications and therapies to make it resolve. ADHD is not like that. The ADHD is not going to go away. The goal is not to get rid of the symptoms. The goal is to equip your child with tools so that the symptoms don't negatively impact their life. And that's why medications don't work in that way. It's just not possible. Medications cannot make you sit down to study. They cannot make you not say things. What they can do is give you a little bit of room so that you can learn skills and tools. It also doesn't mean you're necessarily a bad parent if your child's having behavioral challenges. So some of it, I think, is also the stigma for us as parents. I had a biter. One of my kids was the biter in school. Even though I know that that can be part of this presentation, it was mortifying. So I understand why parents would be like, come on, let's go. Let's
Mhm.
wrap this up. But the best
Yeah.
thing you can do for your child is wrap them in the supports that they need, whether it's medical or behavioral or parenting or support. Yeah. I wish we could just turn off certain things, but that's not how it works.
I know. I know. Any other parting parenting tips that you would offer for parents with kids that have ADHD?
Don't forget to rest. I would say there's so much cool information out there now. Make sure that when you're getting information, if it feels wrong or doesn't seem accurate or seems too good to be true, just be careful of what you're consuming and look for growth, not things to be fixed. So when you see growth in your child, even in something they're just attempting to do more, that's what we want to focus on. Children thrive with being acknowledged. Waiting until they've accomplished it sometimes is just too late. So try to do a good job in your family of just noticing when anybody's trying, even yourself.
Yeah. Okay. And the last thing that I always ask is, how are you really doing?
I'm doing all right. This is a good week to ask. That's great. If you had asked me last week, it'd be different. I'm really loving kind of coming out of the early 13-year-old phase with my son. I feel like we've made a turn and I'm learning all kinds of cool things about who he is and what he's sharing thoughts with me. That's been very exciting. And I'm really excited to be here. So you caught me on a great week. I'm doing great.
That's awesome. And just from like an ADHD perspective, how are you doing with that?
Well,
Like,
that's a whole
just kind
other
of.
question. Yes. I am doing great in one particular area with my ADHD. I want to validate for everybody else. There are definitely days where I still wake up and wish like I could turn it off. And I don't really like feeling that. I wish I could be all sunshine and light and say it's my superpower. But some days it's really a bummer, like, just being able to do normal things. I do think the thing that I've come to in my old age now, I'm 46, it's the best time I've had with my ADHD now, is that I can tell where I'm at in the progress because it goes up and down. And I've gotten really good at asking for support. That will change your life as an adult with ADHD. Recognizing when you're at your limit and asking for support and having someone support you, brilliant. The best thing ever.
Yeah, that is really good. I'm so glad. I am so thankful and grateful that you were here today, and you talked about ADHD and parenting ADHD kids because this is such an important topic, and I learned so much as a provider. So I hope that the parents will benefit a whole bunch, and other providers will as well. So I appreciate your time. Thank you for coming. Thank you for sharing, and thank you for being so open and raw.
Thank you for having me. This was absolutely wonderful.
Thank you. All right. Bye.
Bye.